Have you ever felt a nagging pain in your wrist, elbow, or shoulder after hours of typing or using a mouse? What if that discomfort is more than just fatigue? In today's video, we are diving into one of the most common workplace injuries that can affect anyone, from office worker to factory employee. Repetitive stress injuries (RSI). These injuries, like carpal tunnel syndrome, can be debilitating in left untreated. But the good news is they are preventable and treatable. Stick around to learn the cause, prevention, a strategy, and how you can recover from these injuries effectively. Hi, I am Aman and welcome to today's video on repetitive stress injuries or RSI. If you have ever felt pain or discomfort after performing repetitive tasks like typing, lifting, or even using a mouse, you may be at risk. RSI occur when muscles, tendons, or nerves are overused or strained due to repetitive motion or prolonged postures. Well, tunnel syndrome is one of the most well known forms of RSI. There are many others affecting various parts of the body. But don't worry, we will walk you through everything you need to know how to prevent, treat, and recovery from these injuries. Let's get started. In this video, you will learn what exactly repeated stress injury are and why they occur. Common type of RSI such as carpal tunnel syndrome, tendonitis, and epicondylitis. The cause and risk factor for developing RSI in the workplace, effective prevention strategy to reduce your risk, how to treat and manage symptoms if you develop an RSI, recovery technique, and when to seek medical help. Repetitive stress injuries or RSI are caused by performing repetitive movement or staying in the same position for long period, which leads to a strain on the muscles, tendons, and nerves. These injuries often affect areas like the wrist, hands, elbow, shoulder, and neck over time. A small amount of stress on this area can add up, causing inflammations, pain, and even permanent damage. But what makes RSI particularly insidious is that they don't always appear right away. Often it starts as mild discomfort that gradually worsens over time. Type of repetitive stress injuries. First is carpal tunnel syndrome (CTS). One of the most well-known RSI is carpal tunnel syndrome. This occurs when the median nerves, which runs from our forearms to your hand, becomes compressed as it passes through a narrow tunnel in your wrist. Symptoms include numbness, tingling, and pain in the wrist, hand, and fingers, especially when typing or using a mouse for extended periods. Second is tendonitis. Another common RSI is tendonitis, which is inflammation of the tendons, often due to repetitive motion. Tendonitis can occur in the elbow, known as tennis elbow, shoulder, or other joints. It typically causes pain, stiffness, and swelling, and it worsens with movement. And third is epicondylist. It's called is tennis elbow or golfer elbow. Epicondylists are known as tennis elbow or golfer elbow. Affect the tendons in the forearm near the elbow joints. It is caused by repetitive movement like grabbing or swimming. Pain and tenderness near the elbow are the main symptoms, and they can make even simple tasks difficult. Fourth is decoherence tenosynovitis. Decoherence tenosynovitis affect the tendons at the base of the thumbs. Repeated use of thumbs, such as gripping or twisting, can lead to pain and swelling. This condition is common in people who use their hands and resting extensively, such as workers in construction or assembly line jobs. Cause and risk factor of RSI. Now let's talk about why these injuries happen and who is at risk. RSI develop when the muscles and tendons are overstressed or overworked due to the repetitive motion. Some common causes include: first is poor postures. Sitting or standing in an awkward position for long period place a stress on the joints and muscles. Second is repetitive tasks. Tasks that involve continuous motion like typing, assembly line work, or lifting can stress in a specific area of the body. And third is heavy or awkward lifting. Repeatedly lifting heavy objects or holding them in the same position can lead to injuries. And fourth is vibration. Using vibrating tools or machinery can also contribute to RSI, especially in the hand and arms. And fifth is lack of rest, not allowing your body enough time to recover between repetitive tasks is a major risk factor. Prevention strategies. The good news is that most RSI are preventable. Here are some strategies you can implement to reduce the risk. First is ergonomic workplace setup. Make sure your workstation is set up to promote good posture. Adjust your desk, chair, and computer monitor so that your body is aligned properly. And second is take regular breaks. Take short breaks over 20-30 minutes to stretch, relax, and reset your body. And third is a stretching and a strengthening experience. Incorporating a stretch and a strengthening exercise for your hands, wrist, shoulder, and back and help reduce strain. And fourth is use proper tool. Invest in organic tools such as chair with lumbar support and rest or adjustable desk to help maintain proper postures. And fifth is alternate task. Switch between different tasks to avoid doing the same motion for too long. Rotate jaw and elbow muscles time to recovery. Treatment and recovery. If you have already developed an RSI, don't worry, it is not the end. Early intervention is key to recovery. Here is what you can do. First is rest and ice. Second is physical therapy. And third is splints or breaks. And fourth is anti-inflammatory medicine. And fifth is surgery. If your symptom persist despite rest, or if the pain interferes with your daily activities, it is important to seek medical attention. A healthcare provider can help diagnose the condition and recommend an appropriate treatment plans. Earlier diagnosis is crucial to prevent permanent damage. Repeated stress injuries may seem like minor inconvenience, but they can have a major impact on your quality of life if left unchecked. By following the prevention strategies we discussed today and seeking treatment early, you can protect your body from the long-term effect of these injuries. If you found this video helpful, please like, comment, and subscribe for more tips on workplace safety and health. Remember, prevention is always better than treatment. Take care of our body today for a healthier tomorrow.